You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. There's been a lot of change happening all at once lately, and it can be hard to keep up with the pace of it. And this is especially true when it comes to LGBTQ health. In a very short period of time, we've seen shifts in research funding, data collection, public health infrastructure, and the broader social climate, all of which have very real consequences for people's mental, physical, and sexual well-being. In today's episode, I'm joined by two experts who study how stress, stigma, and uncertainty affect LGBTQ people. We're going to talk about what the science says about minority stress and health, and what might be happening right now as LGBTQ communities navigate increasing uncertainty. This conversation isn't just about what's going wrong, though. It's also about what clinicians, researchers, and communities should be paying attention to, what resilience looks like, and how evidence-based insights can help guide us at a time like this. I am joined by Dr. Lisa Diamond and Dr. Scout. Dr. Diamond is a distinguished professor of psychology and gender studies at the University of Utah and past president of the International Academy of Sex Research. She has spent nearly 3 decades studying the development and expression of gender and sexuality across the life course. She is well known for her pioneering research on sexual fluidity, which describes the capacity for individuals to experience unexpected shifts in sexual identity and expression over time. Dr. Scout is the executive director of the National LGBTQI+ Cancer Network, a sought-after advisor on LGBTQI+ health issues, and an openly non-binary and transgender father of 3. They spend much of their time providing technical assistance for tobacco and cancer-focusing organizations interested in building equity for all. This is going to be a very important conversation. Stick around, and we're going to jump in right after the break. If you love the science of sex as much as I do, consider becoming a friend of the Kinsey Institute at Indiana University. The Kinsey Institute is the world's premier research organization on sex and relationships, and you can help them continue the legacy of Dr. Alfred Kinsey, whose pioneering research changed everything we think we know about sex. Visit kinseyinstitute.org to make an impact. Your donations can help support ongoing research projects on critical topics. You can also show your support by following Kinsey Institute on Facebook, Twitter, and Instagram. Thank you for supporting sex science. Hi, Lisa and Scout. Welcome to the show.
It's great to be here.
Thanks, Justin. It's great to be here.
Well, it's wonderful to have both of you here. So I think it's an understatement to say that there's been a lot happening as of late, and it can be tough for people to keep up and keep track of all the changes that have been happening. But one area that seems to be shifting especially fast is LGBT health, including everything from data collection to research support to the broader public health infrastructure. So to help ground our conversation, can you walk us through some of the key changes that are happening right now?
I just want to know how many hours we have for this because there's that many changes. I'm sorry to say. Just to launch us off, as soon as the election happened, inauguration happened, we were waiting for executive orders to come out. And sure enough, from the first minute, we got executive orders basically attacking trans folks very specifically. You'd think that it would have taken a while for the federal government to even kind of implement those. But then we actually saw another change this year, and that's the federal government started to do some things at lightning speed. I wish we could get them to do the things we want at the speed that some of the bad things really unrolled this year. So A, the federal government, anti-trans, B, lightning speed. C, we also then saw that a lot of the larger LGBTQIA communities were included in these anti-trans things with a splash effect going on. And then D, another just systematic change that happened is that the federal government also stopped following the laws, to be honest, because things like contracts, which were out, were guaranteed for the year, suddenly were kind of tossed out the window and it didn't matter. So one of the first, as Lisa and I certainly know, I knew in going through a few different administrations, we were going to see some of these changes. So I, right before inauguration happened, launched an LGBTQIA research listserv, just so we could figure out where the safe paths were. And in a very small number of weeks, and this is just one of the many places we saw the changes, I was worried about getting people to talk to each other. Oh my gosh, 1,300 people joined the listserv and were popping off immediately because there was so much hostility, honestly. And first they were like, well, what about this? What do we do? Is I've got things that are not being reviewed all of a sudden. I've got other things I'm developing. Should I stop developing them? How will they implement these things? We also saw the Office of Sexual and Gender Minority Research at NIH be disbanded. Then, sadly, in a period of about 5 weeks, we saw waves where honestly every single one of these research projects was terminated. And they were terminated without NIH even usually knowing. They would get back to their project officer and be like, what happened? And the project officer is like, what do you mean? Because literally at 2 a.m. in the morning, these letters were going out. It did not sound like NIH whatsoever because they were weirdly, I can only say juvenile. It's not the way NIH speaks about things. This has never been valuable research. And you're like, it's been on NIH's strategic plan for many, many years now. Like, what do you mean? So, not only was a whole arena disappeared, but then we had to deal with the fact that all these people who had been spending their lives training for this field, suddenly, they were climbing a ladder and the ladder just got yanked out from underneath them. They had to fire their whole labs. They didn't know if they had any job security. It continued to cascade. And that's just one of the many examples of things that were changing.
Anything you want to add to that, Lisa?
That's basically what happened. I mean, I think a lot of us, as soon as the election happened, anyone who had read Project 2025 was thinking, this could be an issue. But Project 2025 was so extreme that a lot of us thought, well, it's not like they're going to dismantle everything. It didn't seem possible to do it. And I think we learned it's a lot easier to eliminate things than to build them. And what is really striking is some people keep saying to me, oh, well, in a couple of years, everything will switch back. And you can't do that. Like, you can't dismantle an entire field. People fired, people switching jobs, people leaving positions, people leaving graduate school, people retooling their careers because they see no likely path forward for the foreseeable future. The idea that you could rebuild that in a couple of weeks, that's not possible. We've never done anything like this. There's no precedent for how we're going to do this. So a part of what is concerning is the utter uncertainty of what actually the next 2, 5, 10 years is actually going to be. And it's only recently that we've come to really appreciate how toxic uncertainty is to our brains and the degree to which there's nothing that the human brain likes less than not being able to tell whether there's a threat around the corner. And now that is the state that we're living in.
And the once burned, twice shy phenomena is really true too. I was just yesterday on a call with a new research project that is not funded by the federal government. And we're all like, yep, can't have any of the bad words in the title. How do we rename it something really oblique and obscure?
Yeah, boy, there's so many things we could talk about here. I mean, this is not a switch that you can flip off and on, and if politics changes in a few years, you're going to have this whole exodus from the field. And are they going to want to come back? And, even if the jobs reappear, will there be any job security there, right?
And also the situation in higher ed has changed utterly, just the attacks on higher ed. So the scientific establishment in this country is interbreeded with higher education. There are independent research institutes, but generally that's how it works. So it's not just that there's this attack on science, there's a simultaneous attack on free speech and free expression, especially about gender and sexuality in higher ed. And so all of these things, the attack is kind of from multiple sides at once.
Yeah. And I have so many friends and colleagues who have been not just very distressed by this, but have been very personally impacted by it. People who have lost research grants, who have had to wind down their labs. A lot of students who were wanting to pursue careers in this area who are now changing course because, again, they just don't see it as a viable path going forward, or there's so much uncertainty behind it. And so it does have big effects in terms of, what is our knowledge base going to be going forward in terms of LGBTQ health? This is a whole field that took, decades to build and to really kind of understand what was going on here and what's going on with the different factors that affect the health of LGBTQ people, both mentally and physically. So what are the downstream effects of this? What happens when we lose like a source of data or research that affects actual care or prevention or health outcomes? What happens when the data that is used to inform public health decisions disappears?
It's a good point because, Lisa and I are both researchers, so we kind of live in the field and don't always convey kind of the outside what the actual impacts of this are. But at its shortest, we don't fix things we don't see. So just as an example, we're talking about issues related to the queer communities. We're very familiar with the fact that there's very high suicidality rates in the queer communities. We only see that because there's been research on suicide in the queer communities. And because of that, we're able to get a queer-specific suicide hotline, which of course has also been canceled earlier this year too, or defunded at least. The hotline still exists with much less funding. So at the core, we're not talking about researchers. We're not talking about research. What we're really talking about is, are we finding out what's happening with a particularly oppressed population and doing anything to try to fix that? And even if one funding source is gone, the reason why there's so much more danger here is because that funding source, research is not cheap. So there's a lot of places where, it's kind of like, we're not going to do research because it's just the most expensive piece of the equation, which is why the feds were usually the ones. NIH is the largest medical research institution in the world, health research institution. So it's when the largest funder of the first part of the chain takes their toys and goes away, you can't do anything else. You can't figure out where the suicide rate is going this year when things are getting worse. You can't figure out what the impact is of state laws, which are getting more obstructive for healthcare for the queer communities writ large. You can't figure out what happens when people can't get hormones off of Medicaid or things like that anymore. All those things stay in darkness. And when they stay in darkness, we obviously can't do anything to fix them. We can't get some other funder to give us money because the problem hasn't yet gotten visible to anybody. So that's why it isn't about research. It's about what are the problems and can we get the resources to fix them? And sadly, research is the first link of that chain.
And also things are just getting dramatically worse right now, right? So the whole reason we have a field of sexual and gender minority health and research on ethnic marginalization as well is because we now kind of know that social stigma gets under the skin and affects the body and affects health. Like social determinants of health. We now know a lot of this stuff. And it's almost like we're doing a big natural experiment in it.
A bad one.
What if we know that it was already bad? What if we just literally dial up the intensity of the rancor and literally have the government saying, you people, you don't exist. You just don't even exist.
We don't want you here.
And so we already know that stigma affects health. And we dramatically increased the amount of stigma and turned the lights off on all of the data that could actually show what's happening. And so that's what makes it feel even kind of scarier. It's like, we're going to do this to you and you're not even going to be able to prove it's happening. You're going to see the suffering in your community. You're not going to be able to document it. You're not going to be able to track it. For Scout and I, that was where it just started to feel like an emergency. Like, this can't happen because this moment, 2025, we're going to be able to find this moment in every bar graph and in every chart for the next 50 years. We're going to see that there was an inflection point here. And we cannot change all of what's happening, but we can track it.
And so what do you think the impacts are? What do you think is happening right now with LGBTQ health? Both of you have spent your careers studying how chronic stress, minority stress, and uncertainty shape people's mental and physical health. So can you just briefly explain, what are the biological or psychological pathways involved, and how do you think they're impacting LGBTQ health at this moment?
There's sort of two different pathways over the years that we've identified. And one of them is really sort of explicit and concrete, that when you bump up against an actual discrimination stressor or victimization or anything like that, the body kind of mounts a stress response. And over time, there's a toll to that stress response. Cortisol, catecholamines, all the things that happen. For a long time, we thought that was the main thing that was responsible for the health disparities. But over the years, we found that there was a lot of physical and mental illness among individuals who, if you ask them to tabulate how many discrimination stressors they experienced, their direct exposure might have been low, and yet their health burden was still high. So what we've sort of figured out more recently is that the toll of preparing, the toll of knowing that it could be happening, and the sort of watchfulness and wariness that for a lot of marginalized individuals is a daily part of existence that they don't even notice anymore. It's like the nervous system is just like, where is it? Where is it next? And that's adaptive. We evolved because that helped us in the ancestral period. But when you live your life in that state year after year after year, what we now know is that actually provokes an immune response, that hypervigilance, when sustained over time, leads to low-grade inflammation in your body, which we now know is a major pathway to pretty much every major health condition. Not right away, usually only by the time you get to age 50 or so. It takes a while to build up, but build up it will. And you actually find most of the major health disparities in queer and trans communities really kind of go up after age 50, when anyone who's over 50 knows that a lot of things go wrong. And so we might not even see the effects of this moment right away. We'll probably see them first among older folks. And then as each cohort ages, you're going to see these kind of escalating responses. It's kind of similar to the way we're still seeing pandemic effects among folks who are in grade school and now they're older, but they're bringing those deficits right into, across the life course. I think it's going to work very similar to that. And we've already, from the preliminary data that we've collected, something like 3/4 of queer and trans folks and their family members say that their depression and their anxiety has increased this year. Over 50% say they're experiencing increases in PTSD symptomology, disruptions in sleep, nightmare, startle responses, intrusive thoughts. These are things that interfere with your daily tasks of living. Now, this is happening to parents, to folks who are holding down jobs, for folks who are caregivers. And so the toll of this mental and physical health burden has ripple effects that are going to be seen really very broadly. It's not just affecting the folks who are being most targeted. It's easy to see that if there's one group that's being targeted, it's trans folks. But every single one of those individuals has a huge network of family members, and the toll is affecting the entire queer community because it's very clear, we're the ones that they hate. So trans folks they're at the tip of the spear, but this is a really broad impact. And that vigilance, that uncertainty, that not knowing what is next, that is going to have consequences over time. And so it's important for us to really kind of get the message out that it's not just your direct hit of, I was fired for my job from being queer. That's what a lot of people kind of imagine. That's what discrimination looks like. And it is. That's a bad thing. That is not the only threat we're facing. This sort of endless watchfulness, wariness, vigilance. That's also somewhere between 30 and 50% were reporting more difficulty sleeping. And we now know that sleep is a major health behavior that affects a lot of downstream outcomes.
And Lisa's kind of jumping ahead a tiny bit because she's talking about data. And we just said there was no data this year because all the research has been terminated. And not just the research, but the surveillance from the federal government on their own surveys is also excluding us. So as she kind of gave you a hint, we spent a lot of time this year trying to figure out what to do to rise to the moment. What did our community need now more than ever? Whether or not we had funding for it. And our conclusion on that was, if both of us as researchers, if there was one thing that, we wanted to wish for this year, is that this wouldn't happen in darkness. That, as Lisa said, you can see it on every bar chart for every year in the future, but you can only see it if you actually measure it. And so we threw back to some of our old school ways and a way we'd been doing things before the federal government started. And we've got a lot of friends and a lot of colleagues who are willing to help. And we went on a grand side quest and are in the middle of a grand side quest now, which is why it's good to be here, of trying to see if the community can collect the data that the federal government would have otherwise been collecting specifically for this year. And so we've launched this community-driven survey called Out the Community
Unfunded.
Survey. Yeah, it's not funded.
A
It is a
kitchen
side
table
quest.
effort.
Yeah.
It's just like queers protecting queers. You know?
Yeah.
And it is sort of similar to the way things were done in the old days when you would hang up flyers in bars, you know, in the 80s, because there wasn't the internet. It was just hand to hand. We called it snowball sampling. And it was like, well, that's all we can do. And then, you know, as the years went by, it got professionalized. Well, that's not possible. So
Deprofessionalized now.
It's like, you know
Yeah.
what? We kind of know how to do this. This was actually how this field began. So in many ways, it's sort of a return to origins.
And we've got 54 community organizational partners working with us on this already. So, you know, we say it's kitchen table, but it's a big kitchen table because there's a lot of us who are worried about this. And, you know, we got almost a couple thousand responses already. As this comes out, it'll still be open. So one of the things we're really hoping is that people continue to like lean in, make sure this moment does not go by in darkness for us.
Yeah, you know, as we were discussing toward the beginning of the show, man, I mean, a lot of this is really dark. And I feel like we could have just had a conversation for hours about the doom and gloom and how, you know, this hypervigilance and uncertainty is not going to go away anytime soon. But I'm so glad that there's a silver lining here, that you're actually doing something about it. And I think this is one of those cases where, you know, research always finds a way, whether the funding is there or not. We always find ways to collect the best data that we can with the means that we have.
My whole career started with an unfunded project where I was just driving around. I'm like, I got no money. I just got a used car. And like a lot of folks in this field started out doing small, unfunded studies. So we know how to rally and we know how to be crafty. And one of the things that Scout and I have talked about is like, as it professionalized, some of us got out of the habit of thinking in sort of a crafty, like, how am I going to do this? Like, we really got very creative in the old days when we had to. Those are like the skills that we're going to need to call upon now.
This has me thinking about when I started my own research career, which was almost a quarter century ago.
And you were like one of the first graduate students. I remember when Lisa Aspinwall and I started the GASP, the Gay Alliance in Social Psychology. You were like one of the 2 graduate students who like showed up to our first meeting. And your whole career, like, your career has sort of spanned this time where it didn't used to be a thing you could safely do. I remember worrying about you and whether you would be okay. And your whole career has matched the arc of this time period. And so you have sort of an interesting perspective on what that must be like for junior folks.
Oh, absolutely. And, you know, when I started my career, I wanted to study LGBTQ relationships. And, you know, the way that people traditionally collected data at that point was through college student samples, but you couldn't really get a sizable LGBTQ sample if you're just surveying college students. And so I started conducting online research at a time when nobody was really doing internet data collection. And then later that became the norm. Now, what's funny is that internet data collection recently has suffered some significant challenges because we've got bots and other things. And so it's a whole minefield when you're trying to collect online data these days. But yeah, I mean, the whole field has shifted. We've always had to find unique and adaptive ways to survey and study the populations that we want to do, whether or not we have the funding. And, you know, I did all of my work for decades without having any funding whatsoever. And it's only actually been in the last couple of years that I've started to receive research funding, but it's only because of partnerships with industry, because it's really hard to get funding from the federal government in general to study anything sex related, but it's even harder now. And especially if you use any words that fall under the category of DEI, right? That just kind of make it impossible because there's a lot of words you just can't say anymore in a research proposal.
I would say that one of the things about this that is also a silver lining is when you have to rebuild a concept from scratch, you know, from your dreams and your extra hours in the day, you're able to think about what's the 2.0 version of it. And so, for example, we've got some things we built into the survey that are very different than the way the traditional research is conducted. We are going to analyze it lightning fast, you know, compared to you usually can wait a year for some of the federal data sets to kind of get the data back out to you. We're also going to actually push the data directly to the community organizations. So we're going to give them like, you know, if you live in Utah, if you live in Iowa, as long as you have enough people, we'll give you the Iowa data really quickly, and we'll give it to you in a way that's pre-digested so that you don't even have to like hire consultants to figure out what the science is. You can just take that sheet to your funders. As a community organizations, you can take it to all the people and be like, this is what's happening right now.
And we'll get it submitted so that it'll be peer-reviewed. But we're not going to wait for that because people are going into the 2026 legislative session with no evidence to say my community needs some resources. And so at the very least, we are trying to at least give folks some basic information to go into this session because things are only going to get worse.
And Lisa, you pioneered in the Utah survey that this is built on, the idea of not just asking the queer folks directly, but also talk a little bit about that, because that's another 2.0 modification we've got in the way this is happening.
One of the things I really became aware of in Utah, because we have very, very large family sizes because of the religious context of the Church of Jesus Christ of Latter-day Saints. And I had done so much work in Utah with the family members of queer and trans individuals. And I became aware that there's a whole other mental health burden. The ones that love us the most are hurting when we hurt. Like, it kind of makes perfect sense. So in the study that we did in Utah, right before and after the legislative session, we opened it to family members, and they were a huge part of the sample, a bunch of these het, cis family members. But there were so many of them that based on like the percentage of the state population that is queer and the average family size, over half the state of Utah has a direct family connection to a queer or trans person. And so if you're trying to make the case to your legislature, this is a community whose mental and physical health needs are escalating and it's an emergency, it's easier to make that case when you can say it's half your state's population. So this is not a niche issue. And the other thing we sort of, extended on that, and Justin, you mentioned at the beginning how many people who are researchers who are seeing their careers upended. We also are opening it to anyone whose work involves this community. And it's not just researchers, but healthcare providers, therapists, social workers, educators, anyone whose job is connected to these issues has also seen a direct impact. And the burnout that I have seen among just mental health providers is enormous. I was literally just texting yesterday with a trans friend of mine who is a therapist. And I was like trying to make plans to go hiking. They're like, I saw 10 clients yesterday in a row because they're just taking emergency sessions. And I'm just like, what about you? Right? And so there's a sense our community wants to take care of each other. We're often not really good at taking care of ourselves, but we take care of each other. And so that's the other thing about this moment, that there's a whole infrastructure of folks who are taking care, the caregivers, the health providers, the educators, the researchers. We're like, oh, we're helping our community, but we are not well. And so that just magnifies the impact as well. So that's another way we're trying to just show that the scope of this problem is not just the queer and trans community. There's like a diaspora. It's like everyone who has been touched by the life of a queer or trans person is feeling the effects of what we're going through.
Should we actually have the survey link here in case people are mildly piqued at this point? Is a possibility.
Well, you made a bit.ly. Don't you have the bit.ly?
I know. Lisa doesn't know what bit.ly is.
I didn't know what a bit.ly was.
We've been going back and forth around that. Yes, if you want to take the survey, if you're queer or a queer ally or professionally in the workforce that works around queer folks.
Or a family member or a loved one.
Family member, loved one, exactly. You can get to it with bit.ly, bit.ly:// out, all caps, community with an initial capital C, survey with a capital S. So bit.ly out community survey.
And we'll put the link.
Yeah,
we'll make sure the link is in the thing.
Yes, I'll be sure to put the link in the show notes for people who would like to take the survey.
Justin, how long have you known what bit.ly is? Am I really behind in the world?
Maybe slightly behind, but...
Okay,
But you're ahead of the curve in other ways.
Are those different from normal links?
Yes. So I love that the two of you are actually trying to do something here, which, brings me to my next question, which is, For people who want to do something right now, what can they actually do? For LGBTQ folks, their families, or professionals who work with them, how do you build a sense of safety and support when you're living in a time that feels so uncertain and unsupportive?
First of all, take and share the survey as a starting point. So don't just take it, but please share it too to help with that first thing. But then, we're actually trying to do this to unleash the next step. And so, Lisa, I know you're about to start talking about that.
We're used to thinking of activism as like, oh, you go big. You do like big things at the national level. What we're kind of realizing is that for the kind of pain that we're experiencing, the solution is the oldest solution in the world, which is gathering together at the local level. That, yes, connecting online, big efforts, there's a place for that. And that will always be true. But we've gotten a little bit out of the habit of gathering together in person and sort of focusing not on kind of big events, but small, regular, trustworthy, safe, connected social interactions. That we know what the antidote to hypervigilance is. It's kind of built into our social brains. It's each other. It's one another. Our brains evolved to get a sense of safety by having someone by our side. And everybody knows what this feels like. There's not a single person who's ever walked into a strange room or a strange environment and felt this kind of weirdness and then seen one person that they know and felt their whole body change in that moment. That's not an accident. Like, we're designed that way. And so if you want to know what to do, it's to connect with others, because it will not only make you feel better, you will make them feel better as well. And I now, typically, whenever I give talks, I end it by saying, I want everyone to take a look at your own social network. Identify 2 people that are friends, that you like, that you feel good around. Spend more time with that person in person for this year. Just make a commitment to actually deepening, regularly seeing, like, there's a magic to that. A little bit of shared one, like Scott and I were like putting together a formula. It's like a little bit of shared vulnerability, some proximity, and repeat. Like wash, rinse, repeat. It's the oldest thing in the book. It's free. It's available to all of us. And it's probably the most important health intervention that any of us can do right now.
And what a fantastic New Year's resolution too, right? If we all resolve to have more of that in-person contact with people who support us, make us feel good, it's probably the best thing we can all do for our mental and physical health.
I mean, like, the data on that is so fucking clear. Like, oh, I cursed. I'll say that.
Oh, you can say whatever the fuck you want, Lisa.
We have known for years. And I was just giving a lecture to my love and relationships class at the University of Utah. I'm like, if there's one thing that you could do to promote your physical and mental health long-term from now until you're like 90, it's not quitting smoking. It's not quitting drinking. It's not even sleeping more. It is the quality of your social ties. Like, done. Like, the data's in. That is the thing. And yet it's so hard to get folks to like put on their shoes and pants and leave the house and actually kind of be in person. We were already on a downturn with social relationships before the pandemic. A lot of it was because of just demographic changes in suburbs and things like that. Then we had social media come in, and then we had a pandemic, and we never recovered from that. And now we have this election. So we're in kind of the worst case scenario. But if there's one thing that's in our control, it's that. That's the only thing we can completely control, is our connections with one another. And so it's like, well, if that's the lever that is available to you, and it happens to be the one that will have the greatest long-term benefit, grab that thing, grab that lever. So one of the things that we included on our survey, we have a pretty detailed assessment of the strength and the quality of their social network. And we asked folks if they are interested in changing their social network and if they want resources or information on how to do that. Because I think there's a lot of people who are kind of quietly complaining, like, I don't have people that I can just call up on a Wednesday and say, do you want to just get together and complain about the world? So a lot of folks, I think, would like to have more nurturant social ties in their life, and it's hard to do so. So the other thing we're trying to do is figure out ways to get communities a little more connected to one another.
And if it doesn't go without saying, obviously, think about where you stand in your social connections. And if there's any way you can kind of reach out specifically to people who might be downstream from you as far as the specific impacts of this year. I mean, I do lots of trainings, and I would always, talk about, why don't you invite, if you have a trans friend, invite them over for dinner. Just do something to kind of start to elevate that connection a little bit more. Particularly, I'm a middle-aged trans guy, and it's probably not as routine for other non-trans people to be living in an environment where other colleagues my age are actually suicidal, because we overestimate the level of social connection that particularly the trans community has always had. So if you've got transgender, non-conforming, non-binary people in your life, particularly the youth, what can you do to specifically add a little bit more energy to that connection? You'll get reward from it, and they could potentially need it much more than you guess. So, think about just in the larger context, are there people downstream from you that are getting more of these adverse impacts? And could you particularly reach out and try and strengthen those connections? You both get the rewards.
And I think people assume because they say, oh, well, they went to a pride parade or they went to a thing. I have had so many of my students, my undergraduate students, tell me, queer students, that they have never felt more lonely than at a pride parade, because they have this feeling of like, well, where's my friend? It's not just the group, it's friendship. It's actual friendship, which is not a support group. It's not some big political rally.
Big party.
It's someone that is like, oh, I was going to go shopping for shoes. Come with me. Or, I have to do these errands and I'm bored. I told my students at my class, I said, go waste some time together. Just be together.
Introverts know all about this, right? Just the one-on-one connection stuff, not a big group.
Yeah, find somebody that you can go waste some time with. I think that's good advice.
It's a health intervention. It's actually a health intervention to do that. And I think people, they know it when they feel it. But again, we've kind of gotten out of practice at actually making the effort. And so people were like, well, the queer and trans people I know seem fine. It's like, don't put the burden on them to be the one to reach out to you, because that's a really vulnerable thing, especially for a marginalized community, to say, hey, I would like to have dinner with you. Make it easy. Make it easier by just being like, what are you doing? Do you want to come over? The other thing I advise folks, it's like the easiest way to make someone feel safe. If they're going somewhere, offer to go with them. I'm going to a doctor, like, do you want company? Do you want someone to go with you? Going with someone, it's almost like the basic form of like human connection. Where you're traveling, I'll just be next to you. Like, that is powerful in and of itself.
There's some interesting stuff going on demographically from non-government research, of course. And that's that just from last year to this year, the number of people in the United States that identified as queer jumped by a pretty big hunk again. And it's jumping mostly driven, of course, by the youngest cohorts. So the young adults, and then people even younger than that, youth. And that's exciting because that's really the future we're moving into. Whatever the laws say, they cannot stop this future from unrolling. They cannot stop these people from being queer and trans. But it also means that right now we have many of those either young adults or youth that are newly identifying with a population that is so directly under attack. And we know from long experience that that doesn't mean they have the family support. That doesn't mean they have the friend support. So as you think about like the people you can connect with more, if you've got anybody like that's younger in your life, that's in one of these directly attacked populations, make that a priority, because that, the suicide rate is over 40% for the trans communities. And that was before this year. I am frightened to think about what it could be this year. So, our first mission is like, let's get these people to adulthood. And what we've seen makes the biggest difference in that population, an 8-fold difference in dropping that suicide rate, is having one trusted adult. Just one. So, the bar isn't high. We're not trying to put people on the moon here. We're not trying to colonize Mars. We're trying to give every vulnerable person one trusted adult. And that can have the biggest health difference. So again, you don't need to be like a national advocate to do that. That's just, if you've got a nibbling, non-binary niece or nephew or something like that, that's being a trusted person. We all could do that.
Yeah. Being that trusted person or building that supportive social network, these are key things to our health and well-being, not just as individuals, but in terms of our community. And I think that's a great resolution. Something to think about for the new year is how we can all help to build more supportive community networks. So thank you again so much for your time, Scout and Lisa. Can you tell us again where people can go to take part in the survey, or if they want to learn more about the work that you're doing?
Lisa, could you? No, I'm kidding. We won't make you do it. bit.ly// out all caps, community with capital C, survey with capital S. That's where you can go to fill out yourself and then make sure all the other queer allied, queer family, and queer people in your life hopefully speak up to make sure that this year will not continue to happen in darkness like some people want, but we'll take back the power. We'll do it for us, by us.
Well, thank you both again so much for your time. I really appreciate having you here, and I'll be sure to include that link in the show notes for anyone who wants to take part in this research.
Super. Thank you, Justin.
Thanks a lot, Justin.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology Premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.